Good morning, Sri Lanka. Another Monday, another week. And continuing our segment on pain management from the last 2 weeks, we have with us in studio, in discussion, Dr. Namal Senasinghe, the consultant in pain medicine all the way from UK. Doctor, so what do you think of the segments that we have had so far?
Very interesting, and I think it was good.
And we've discussed the back so far.
Yeah.
So today let's move on to another part of our body that gives us a lot of pain, and that is legs. So what do you think about leg pain?
Pain in the legs is a very common presentation amongst most age groups, more likely in the old age group, and then women as well. It can present in the young adults. There are many causes for pain in the legs. I can divide into neurological causes, and then the second one is vascular causes. Third one is, as I always divide them into easy categories, infections, and then fourth one is of course malignancy, and then trauma, the fifth one. So if I say neurological, is commonest one is neurogenic claudication, which is due to pressure on the spinal cord, which is called spinal stenosis. Pressure from all parts of the spine in the spinal cord, it makes it tight, and that affects the blood supply to the legs, and then it causes ischemia of the legs. So pain is present throughout, whether you are walking or at rest. So that's called neurogenic claudication. And the second one is, and also in the neurological segment, you have the pain due to motor, which is coming from the spine. I told you the current like shooting pain, and then also there are sensory causes such as the diabetes can give to peripheral neuropathy, especially in the glove. It's called stocking.
And that's something most diabetes patients are not aware of.
Yeah.
Yes.
It's a pins and needle sort of pain, uncomfortable. Sole of the foot is painful. Both sides. It's like a stocking from the toes up to the at the level of the stockings. So that's why I call glove and stocking. Gloves in the hand, stocking in the legs, and also. Then you got the other things like vascular mainly due to blood supply. There is some obstruction in the aorta, the big vessel that's supplying the lower parts, also from the other common iliac arteries, so constrictions, smokers, and they can get vascular claudication, where the pain is mainly generated by exertion, which is when you walk for 100 yards they get pain, so you stop walking then start again. So the other one is trauma. Obviously, if you have a traumatic injury,
yes.
that's going to leave
fractures, sprains,
and also hip replacements, knee replacements. All that will cause. They are iatrogenic. Doctors, we give the patient the pain. Okay, and then other things like amputations. I mean, a lot of soldiers have got amputated. That can produce a phantom limb pain. Phantom limb pain is that when the leg is amputated, you still feel as though you have your foot. So therefore, the pain you still feel the amputated leg, the foot is hurting you, but there is no
pain.
Foot. Yeah,
yes.
There is no foot, but you still get the impulses from that foot to the brain, and you feel you have the pain in the below the knee, but your below the knee is missing. So that's the phantom knee. It's a mirror image. Yeah, and then you have also the stump pain in the stump area, amputated area. You can get pain, and also infection as cellulitis, commonly diabetes due to chronic inflammation. You can get pain, and also I could mention in the vascular, the ulcers, arterial ulcers, venous ulcers. They all can give pain.
And even things like more commonly varicose veins.
Yeah, that's the venous cause, yeah.
Venous cause.
Causing venous ulcer.
Ulcers, yes.
Yeah.
So, doctor, how can, does something like paracetamol or taking pharmaceutical tablets, over-the-counter tablets, help to alleviate the pain? Do you recommend that as the best way to go?
I mean, that's better than nothing. I mean, that should be the starting point.
You mentioned this before, I mean, we were speaking about the back as well.
Paracetamol is good, it's a good painkiller, then, but then I don't know how ibuprofen is going to work. Things like anti-inflammatories probably doesn't work in other, vascular pains and things like that, because the cause is not inflammation. So we can help the patients by interventions for, as I told you, for the motor. If there is this problem, you can inject the spine, root blocks higher up, and then that alleviates the pain. And then for one of the common things is the phantom limb pain, very challenging to treat, but then we have new techniques like spinal cord stimulators, very expensive, is used in the West.
Is it something like an electrical therapy?
Yeah, it's like you pass, this should be another segment later on, we'll discuss that, but you pass 2 wires into the spinal cord and you stimulate the spine, and then that takes that pain away. It's the same as the mosquito bite. With the mosquito bites we scratch, and the same theory there. So without scratch, you stimulate the spinal cord at that level. So it's supplying that, and the nerve supplying that area. So that's phantom limb pain. Then also you got some, venous ulcers, difficult to treat, all the arterial ulcers. So it's mainly applying local anesthetic patches. I don't know whether they're available in Sri Lanka, probably not. We have the local anesthetic patches in UK, lidocaine or lignocaine. They come in plaster, so we can apply in those areas. That will numb the skin around those. Yeah, and then treating pain due to diabetes is quite challenging, and I think it's very difficult.
Because it also comes down to controlling your diabetes as well, isn't it?
Yeah, yes. Absolutely. And then we can treat mainly by medication. We can do, start them on the anti-epileptics, gabapentin, pregabalin.
Anti-epileptics?
Yeah, that has an effect. This diabetic pain is a neuropathic pain. It's not a motor, it's a sensory, due to the autonomic nervous system. It's due to the sympathetic and the parasympathetic nervous system. So the anti-epileptics such as gabapentin, pregabalin has an effect, and it represents like amitriptyline and also the other duloxetine, things like that. They have effects on that.
So doctor, what are the home remedies that anyone who's suffering leg pain can undergo? Is it something like massages or relaxation therapy?
Of course, warm water, you have to put your feet in a
warm water.
Not hot water, but then,
lukewarm.
Yeah, and then massaging is always good, and then simple analgesics. It's getting to know your pain and just dealing with it and get on with life. And also I couldn't mention, for the vascular pains, ischemic pains, we can do sympathetic blocks. The sympathetic nerve is in the lumbar area. So your blood vessels, the size of the vessels are controlled by the sympathetic nervous system. So there is a constriction, there is tightening of the vessel. So when you block the sympathetic nervous system, the vessels relax. So your blood supply gets more. I have done them in UK. You can do radio frequency by passing a current into the sympathetic nervous system without opening. You can kill the nerve, in short layman's term. Yeah, so you call it denervation.
But this is the last resort, is it?
Not a last resort, but not a permanent cure either. It's very challenging. So some people it works, some people it doesn't. But I had a patient the other day who came for bilateral, and he says it worked, but then it's to be seen. It varies from person to person.
So what's the action that someone in Sri Lanka can take, doctor? What are the common ways of treating leg pains, and what are the common things that patients should look out for?
You have to exclude. You have to go and see the specialty. Let's say if you have intermittent claudication, so you can't walk. You walk some distance. You have pain. Then you can see a vascular surgeon. So it's up to the vascular surgeon to refer these patients. If there's no remedy surgically, to refer them to us, or if they have done surgery, if there is no relief, send them to us. So it's a referral system, but I don't know how it works.
So how should the patient prepare, doctor? When they come for a consultation, maybe sometimes they're not prepared in the correct way, they don't know how to answer the question the way you want them to. So how can someone at home prepare themselves to come and meet you for a consultation?
Yeah, I find it very challenging taking histories from people, our own people actually. I mean, for instance, you spend about 2 minutes trying to figure out what their date of birth is. When you ask the date of birth, they tell, they say, and then you have to ask them a month and what date. It's straightforward in UK. They'll say 12th of October 1965, or so you spend time. Doctors have to be patient. You are dealing in another culture, and also especially with pain, the main thing is where is the pain, when did it start, was it sudden or took a long time, how does it affect your life, what factors increase the pain, whether cooking, walking, washing, that sort of thing, and then what relieves the pain, and what is the pain score, which is 0 to 10. 0 is no pain, 10 is worst pain. What is your worst pain? So in England they might say 8 out of 10. So when you take tablets or do something that helps you, to which level it drops. So very few, actually you don't have to spend a lot of time asking people. If they ask you, if you tell you the right thing that you want to hear.
All right, doctor. So I think we learned a lot about leg pains today on this week's segment, and throughout the weeks we've been learning a lot of things from you. So tune in again next Monday as well. Thank you, Dr. Namal. And that's it for today's segment, ladies and gentlemen. Have a good morning.
Thank you very much, Mohammed.